As a disabled person, we have different groups of challenges.
There are a number of challenges that children with special needs, actually also adolescents with special needs, go through. The first challenge starts from home. There's a lot of stigma. There's a lot of absenteeism. There's a lot of neglect. When they go to schools, there's no inclusion. We say it, but the schools are not as inclusive as being said.
When like an opportunity pops up and you go to the hospital, the challenge is communication. We are limited in our communication because like some nurses, doctors, they have never learned sign language. Meaning that is a gap and a limitation for the hospital to treat us very well.
N'ababazala bennyini tebabafaako. Ate abamufuddeko oluusi bafuna ebizibu nga babatya n'okubagamba olw'ensonga nti baba bakambwe. Ate n'olumu abazadde okubaterekanga mu nnyumba okutya okuswala. Abamu tebaagala kulaga nti bazaala abaana abo abaliko obulemu. Ate bwe tusanga abaana abamu bakozesebwa barepingibwa, abamu bafuna n'embuto nga tebalina bye bayinza kwogera. Ebyo byonna bisoomooza mu bulamu bw'abantu abo naffe bakansula.
Over a period of years, I have worked with children with special needs and going into adolescents as well. And I have encountered a number of challenges. The challenges starting from home is usually that the mothers who give birth to these children have no prior knowledge about disability. The second thing is that we always say men are running away or fathers are running away. But has any one of us asked why these fathers are running away? But also generally as a community, we have not embraced these children to understand that they are children first. We use terminologies like disabled children, whereas we could think through and say, you know, they were children first before they got the disability. The mothers fail to work because also having a child with a special need is already a job itself. So at the end of the day, the challenges are social, economical, financial, political, and it stretches on a wide range.
Children with disabilities, we need to protect them so much because they are also Ugandans, they are human beings, they are living, they must eat, they must be protected, they must have everything. For example, like the basics such as education, medical facility, medical awareness, and security must be paramount.
At NAYO, when we started our health department, our medical department, we needed to include the people that are marginalized, that included people living with disability. We went out to the community to identify families that had adolescents and young people who are living with a disability so that we can extend our services to them. When we got there, it was just a tip of an iceberg. Because initially, people with disability in our community are not visible. You can't find them in the markets, you don't find them in the churches, you don't see them anywhere. But when we went the first day, we saw over 9 in 3 hours and we realized the problem was deeper than we thought.
Abantu abo bangi gye bali naye bwano mu community bwoba totuuse mu bifo oba mu bisulo gye babeera tosobola kutegeera nti gye bali. Kubanga nakugambye nti abamu babakweka, abalala tebabafaako, abalala babateekerayo bukeegi balinga abalunda embizi, abalala babaleka eyo tebagala na boogerako.
NAYO as an organization works with adolescents. NAYO works on issues to do with sexual reproductive health. And at that point in time, they realized that they had had a number of children in that age group, which is at the adolescent stage, that also have disabilities. And these children also suffer or go through adolescence like any other child. So this is the time when they decided to have community outreaches, but also work with children with special needs who are adolescents in that area.
Every adolescent and young person who is living with a disability gets a free service from our NAYO Young People's Clinic. However, we noticed that there are still challenges to access to come and receive the services. And when we got deeper into the communities, we also realized that there are socio-economic challenges that are faced at community level.
We had 2 young adolescents, one a girl of 17 and the boy was I think around 16. The girl had Down syndrome with severe malnutrition and anemia, and the boy had cerebral palsy with severe malnutrition. but again with contractures. These were kept indoors due to society discrimination, but during our home visits, we referred them to our clinic and assessment was done, where we referred them to Mulago National Nutritional Unit. But unfortunately, one of them couldn't manage to reach there because of limitation in funds, and the other one went there, but again there were social issues where the mother had a mental breakdown and she had to get a discharge before the treatment could be completed. Unfortunately, we lost both of them because they couldn't access treatment within the specified period.
At NAYO, in the bid for inclusion of people living with disability, we decided to go to the communities so that we seek out for them and give them our services. But what we found in the community, the problem was bigger than we thought. Some of them are able to come for our services, but some of them are not able to because of sociocultural reasons. There are still challenges to access to SRHR services.
We need holistic care for these people living with disability. And holistic care looks at the family. How can we cater for the family? What can we offer the family? And then you look at the facilities. How can we bring them to the facility? Because there is that delay of transport in between.
At New Life Adolescent and Youth Organization, we reach out to the families living with people with disabilities, and we give information about sexual and reproductive health using our simplified guide that we give them at a free cost to the caretakers and to any other adolescents that are able to read. It is translated in Luganda as well for better communication in the community. Then we also engage the people in the community to make these reusable sanitary towels that we give out at a free cost to these families with people with disabilities to help them improve their menstrual hygiene.
We must protect children with disabilities. And disabilities does not mean only one single sex. We need boys and girls. They are all children. 2, we love them. 3, feed them, have love. There are schools that are caring for children with disabilities. Take them. If you don't know, please come to police. We shall advise you, we shall guide you how to handle that.
We call upon the Ministry of Gender, Labour and Social Development to come up with programs that target the communities, to give information to the communities on issues to do with disability, but also rights of the people who are living with disability. We call upon the Ministry of Health that when they are programming, they should cater for the people living with disability, those who cannot come to the health facilities for services. So if there can be a program where they are reached in the communities with immunizations that happen, with even accessing sexual and reproductive health services, it will be a good favor. We also call upon the Ministry of Education to integrate issues of disability, to give information to the young people to grow knowing that even the people with disability have rights, the same rights that they have, those that are living normal lives. We also call upon academia to influence researchers to get interest in issues of people living with disability, because without data, we cannot advocate for this group. Without data, we cannot ably program with evidence that is seen.
NAYO etuyambye okuba nga yajja wano mu community yaffe ey'Ekiwenda. Eraze abantu obulungi bw'okubeera n'abantu abo. N'ekirala bongeddemu ebirungo by'okuba nga babasomesa n'okubawa obutabo n'okubalabirira n'okubanoonyeza obujjanjabi.
We are doing all our work with support from America Jewish World Service, which has supported most of our work, and we are calling upon other partners to come and we collaborate so that we make this happen. We hope to achieve our vision, which is healthy adolescents and young people who are empowered to achieve sustainable development.